Welcome to the deep dive. Today, we're looking at a really pivotal study, one that kind of challenges some long-held ideas about a pretty critical social issue. We're unpacking Enduring Stigma, the long-term effects of incarceration on health. It's by Jason Schnittker and Andrea John, came out back in 2007. And what's, well, kind of striking right off the bat is how medical sociology, which focuses so much on social forces and stigma, mostly missed the boat on prisons' health effects for decades, even while incarceration rates were just shooting up after the 70s.
It's true, yeah. There was this dominant idea, this selection bias theory. Basically, the thinking was that, well, inmates have poor health because of things that happened before prison or life choices that, also led to crime. But this study really digs into that and questions it pretty rigorously. It suggests there's more going on.
Okay, so that's our mission for this deep dive then. Does getting locked up actually cause health issues? And maybe more importantly, what are those long-term ripple effects after someone gets out? Let's get into it.
Okay, so what's really fascinating and maybe counterintuitive is that the study finds the strongest negative health effects actually show up after someone's released. And get this, they found that any contact with the prison system, it didn't really matter how long you were inside, tended to increase the odds of having severe health limitations later, which points very strongly towards what they term a stigma-based interpretation.
Right, stigma. So it's not just doing time, it's the label, the mark that sticks with you afterwards. How exactly does that stigma actually play out for people trying to rebuild their lives?
That's the core question, isn't it? How does this mark work? The study points to a few key pathways. Think about jobs first. A criminal record that basically acts as a negative credential. It really hurts your chances with employers, cuts down wage growth. Then there's the personal side. Prison life itself can change people, maybe foster suspicion, aggression, traits that make trust and intimacy really hard after release. So you see impacts on marriage stability. And on top of all that, you have actual policies denying felons the right to vote sometimes, or access to public housing, maybe welfare benefits. It ends up being this whole interconnected web of risks. One thing leads to another, what researchers sometimes call stress proliferation.
Wow, yeah, web sounds right. It sounds like a cascade of problems. But I remember there was a small, kind of interesting detail about some people actually seeing short-term health benefits inside. How does that fit in?
Yeah, that's a nuance they noted. It seems for recidivist people who've been incarcerated before a current prison sentence might offer some temporary health pluses, probably because, they get access to regular health care inside, maybe structure they lack outside. But, and this is key, for first-timers, incarceration reduced health. And crucially, any of those temporary benefits seen for recidivists, they absolutely do not last after release. The big picture is still about that lasting negative impact.
Okay, that makes sense. Now, we know incarceration rates are disproportionately high, especially for African American men. Did the study connect incarceration directly to those racial health gaps?
That's a really important point. And what they found was, maybe surprisingly, that while those incarceration rates are disproportionately high, incarceration itself only modestly explained the overall racial health disparities they saw in their data. Things like differences in schooling and income. Those turned out to be much, much bigger factors in explaining those health gaps. They also didn't find strong evidence for what you might call synergistic effects, like incarceration being extra harmful for one racial group compared to another, or for those with less schooling. That challenges some earlier thinking.
Interesting. And what about people serving really, really long sentences? Was the effect the same there?
Another good point. For individuals serving exceptionally long terms, or those who are persistent recidivists, that direct causal link between the current incarceration and poor health seemed weaker. It suggests that for that specific group, maybe those pre-existing conditions or characteristics, the selection bias idea, might hold a bit more water. But, and this study really stresses this, most prison sentences are actually relatively short. So when you look at the whole population, the overall impact of incarceration on public health is still massive because so many people experience it, even if for shorter periods.
Right, the sheer volume matters. And you mentioned their methodology earlier. They used something called fixed effects. How did that help make their case stronger?
Exactly. Fixed effects models. They use data from the National Longitudinal Survey of Youth, which tracks people over a long time. And fixed effects basically lets you compare individuals to themselves over time. It helps filter out the influence of stable, unchanging characteristics, things like, say, baseline intelligence, or maybe childhood background, things that don't change but could affect both health and crime risk. By controlling for those stable, unobserved factors, it makes the argument that incarceration itself is causing the change much more convincing. It strengthens that causal claim.
Okay, that's clever. It paints this picture of a process with really far-reaching effects. Did they talk about the impact beyond just the person incarcerated, like families?
They did. They talk about the collateral consequences, this sort of long shadow that incarceration casts. It goes way beyond the individual. Think about families, uh, children especially. It can be incredibly traumatic. Sometimes mothers might even hide the fact that a father is incarcerated, leading to this kind of difficult conspiracy of silence within the family. And then zooming out even further, high rates of incarceration can destabilize whole neighborhoods, potentially undermining social bonds and community control.
So this deep dive, it really hammers home that incarceration isn't, just a criminal justice thing.
Right.
It's deeply intertwined with public health. The consequences are complex, they're long-lasting, and they ripple out way beyond the prison walls.
Absolutely. It really highlights how one major life event, like going to prison, can trigger this whole cascade of other stressors, the job problems, the relationship issues, the policy barriers. It just keeps piling on, undermining a person's ability to cope and get back on their feet. It's that stress proliferation idea in action.
So, thinking about everything we've discussed, what really stands out to you? And maybe for you listening, how can we start to better grasp and maybe even address these really wide-ranging collateral consequences, not just for individuals, but for families and whole communities? Definitely something to think about until our next deep dive.